Muchísimas gracias, Jania, y gracias a todos por estar aquí el día de hoy. Mi nombre es Sarai Serrano, yo soy gerente del programa de salud de la Federación Hispana y tengo conmigo a mi compañera Anaí, que le voy a dar el espacio para que también se introduzca. Estaremos hablando el día de hoy acerca de qué es la Federación Hispana, nuestra misión, nuestros programas, qué es lo que hacemos. Y cualquier preguntita, em, con gusto se las responderemos. Entonces, Anaí, si gustas introducirte.
Hola, buenas tardes a todos. Mi nombre es Anaí Santibáñez, soy gerente de programas y subvenciones de la Federación Hispana, en la oficina de Carolina del Norte. Estoy ubicada en nuestra oficina en Mount Olive, que es un área rural, no sé si la conocen, pero de ahí estoy presentando el día de hoy.
Pueden ver mi pantalla, me imagino, ¿verdad? A ver, ok.
Thank you, Sarai. I'm going to switch to English because I feel more comfortable giving this presentation in English, if that's okay. But today I'll be talking to you about Hispanic Federation. Hispanic Federation is a national nonprofit organization founded in 1990, and our primary focus is to support the Latino community. And we do this on the local level, on the state level, and also at the national level, primarily focusing on strengthening Latino nonprofits, but we also have community programs that I'll talk about a little bit later. We have regional offices in New York, which is our headquarters, but we're also in Connecticut, we're in Florida. We have two offices here in North Carolina. We're also in Puerto Rico, we're in Washington, D.C., we're in California. And besides that, we actually work all over the state with approximately 41 states working with Hispanic Federation. So what do? We have three areas of work, and I'll go a little bit more detail into this later, how it works in North Carolina. But nationally, the way that it works is that we have these membership services, where organizations can become members of Hispanic Federation and receive capacity building support, leadership development, board recruitment, board placement, fundraising workshops, and a lot of different technical assistance. We also have advocacy services that we do. So this is actually why we have our office in Washington, D.C. We do a lot of advocacy. Oh, I'm sorry. I didn't realize I was talking too fast. So we do a lot of advocacy on anything that may affect the Latino community. So we do advocacy on immigration, on reproductive justice. We also do advocacy on environmental justice, and then other things that may come up each year. And then lastly, we have our community assistance programs. Again, I'll go over these a little bit more in detail later and how they translate in North Carolina. But these areas are education, immigration, health, economic development, civic engagement, and the environment. We have this little map of where Hispanic Federation is operating. So as you can see, there's just a couple of states that we have not just reached yet. But we have 650 member and partner organizations. That's in 42 states, Puerto Rico, Washington, D.C., and anywhere where you see color on the map, this is where Hispanic Federation is working. So our North Carolina office opened in 2019. It actually opened just a couple of months before the pandemic. So our first couple of years was actually only working on health resources. We are always reaching the Hispanic Latino community. We are also reaching the immigrant community. And because of this is actually how Hispanic Federation started to grow. So why we do our work, there are over 1 million Latinos who live in North Carolina. There are two places that have the highest concentration. That's the Triangle, and then Mecklenburg County. Mecklenburg County is actually where we have one of our offices, and it is a county with the most Latinos, and that is where we have like our main North Carolina office and why we actually had it there. Our second office is in Mount Olive, North Carolina, which is in Duplin County, and Duplin County is the county with the highest percentage of Latinos in the state as well. So, in the state of North Carolina, 10.7% of the population is Hispanic or Latino. And then, even though it's more small in numbers in the rural counties, they actually have a faster growth of the Latino population over the past 30 years. So, as I mentioned before, in Duplin County, there is a 23% number of the Latino population compared to the entire population of Duplin County, which again is a very rural county. Um, Most of the growth in the Latino community in North Carolina is actually from births of Latino families, and then they're having children, and that's how the Latino community is growing here in North Carolina. And overall, the Latino community in North Carolina is pretty young. The median age range is 25 as of 2021. So it's a young Hispanic community in North Carolina. So the current population predictions show that by 2050, 24% of North Carolina children are going to be Latino, which is 18% more than today. 14% of all North Carolinians are going to be Latinos in 2050. And it'll vary by county, but again, in another very rural county, Johnson County, just slightly southeast of Wake, it's expected that 56% of the childhood population will be Latinos by 2050. So this is a map of where we are working in North Carolina. We work with a lot of partners all across the state, primarily focusing on Latino-led and Latino-serving nonprofits. So everywhere you see a star is everywhere we have worked so far or have partners in that we work with regularly. And so now I'll talk a little bit again about our programs, but how these translate into North Carolina. So the first thing that I had mentioned were membership services that included capacity building. So some of our capacity building things are these Entre Familia workshops that we host. So this is a series of workshops that have trainings that are available for the Latino-led and Latino-serving nonprofits. They are basically professional development opportunities or opportunities to grow the sustainability of your nonprofit organization. We also have Entre Comunidades, which is very similar, except that these are in person. So it's the same, but in person. And then lastly, we have our Encuentro of NC Latino organizations. We host this once a year, and it is usually a 2-day event where we do trainings, we connect as organizations, and we try to support each other, find collaboration opportunities and stuff like that. This year, we will be hosting it in Raleigh. In the past years, it's been in Charlotte. I believe it's going to be in March, but I don't remember the exact date off the top of my head.
The 23rd and the 24th.
So our first area of work with the community directly is civic engagement. So we are a nonpartisan organization. We register people to vote across the state. We work with partners to canvass everywhere we can. We focus a lot in Charlotte and Mount Olive, again, because this is where we have offices. But we also work with organizations like Casa Azul de Wilson. We also worked with organizations like NC Congress of Latino Organizations to reach those communities and register people to vote. We do voter education as well. So again, this is nonpartisan. We don't typically focus on the candidates. Rather, we would focus on their seats and why those are important. So we'll do a lot of trainings on why your city council member is more important to you than the president of the United States or your senator or something like that. And then we also mobilize voters to the polls. We've done party to the polls where we rent party buses and we get a ton of people to come to wherever we are and just literally party till we get to the polls, and then we go vote, and then we come back on the party bus and drive back to where we were. So it's a really fun event, honestly. And we do this every year. We don't just focus on major elections. We have this during like years like 2026 where there's midterm elections, but also off election years where we're voting for much smaller seats. We will always do these events. We also have our economic development program. So this program is growing a lot in the past couple of years, specifically 2026. So we have a digital workforce program, which is a partnership with Google, where we offer scholarships to take some popular Coursera courses, which are the courses available with Google. So these include project management, UX design, IT support. We also have one on AI, which is new. It's exciting. We have the Latino Digital Accelerator, which are digital labs that have these curriculums. So we have two classes that are concurring in our Mount Olive office. The first is an intermediate class for people who know how to use a computer and want to learn more on how to use the things that are offered by Word or by Excel to make a budget. Or even navigating the internet to do things like my chart or navigating their county's website for the courts to pay off tickets or anything like that. Our second cohort is more beginners. So we talk about what are the parts of the computer? How do you turn the computer on? How do you use the mouse? How do I follow my mouse? How can I make the mouse bigger so I don't lose it? Stuff like that. And then we also have these more one-time specialized classes where we focus only on one topic. So for example, we'll do an introduction to your smartphone for older adults who have these smartphones and don't know how to use them. We also have one to learn about WhatsApp and how to use the features available on WhatsApp because that's what our community will mostly use to message each other. We have some that are like learning how to use popular coding languages like Python or Java or JavaScript. And then we also have cybersecurity that we focus on. We also focus on like basic troubleshooting for your computer or your phone or stuff like that. We have a financial literacy program as part of economic development as well. So we will do these trainings. And a lot of what we do is where we travel across the state and host something. And that's the same with this financial literacy program. So we'll travel around and host a training on financial literacy that covers budgeting, it covers savings, it covers paying off debt. It also talks about how to prepare your minor children up for success. So how can your child have a good credit score before they're 18? Stuff like that. We do have a hunger relief program that's mostly focused in Puerto Rico, actually, and as well as the farm and food worker relief program, which is also mostly focused on Puerto Rico. But both of these is to support people who were affected during COVID and were not able to work and need assistance with money to pay bills or bills that may have been backed up since then. These are some of the digital skilling centers that we have across the United States. Here in North Carolina, we have one with Latin American Coalition in Charlotte. We had one with El Centro Hispano and Code the Dream in Durham. We have one with Salud Sin Fronteras in Wallace, and we actually do have two more since this was updated. We also have one with Charlotte Gamers Network, also in Charlotte, and then Valores, which is located in the Triad and does something very similar to what we're doing. And then there's also, actually, I forgot to mention Isla, who also has a computer lab located in Durham. Yes, I will slow down. I'm so sorry. So for our education program, we have something called Crear Futuros. Education is actually the smallest program that we have in North Carolina. It's pretty big at the national level, but here in North Carolina, we have this Crear Futuros program only with NC Central University. And this is kind of like a mentorship program for Latino students or students who are first generation. And this is not necessarily the kind of program that you'll find on most campuses where you can find tutoring support or stuff like that, we actually talk about like your FAFSA and how to change it and how to, do your FAFSA if your parents are undocumented, or how to change your major, how to find a community in a space where you don't feel at home and stuff like that. This was created because Latino students were dropping out in higher numbers, not because the course was hard, but because navigating the college was difficult, navigating the social landscape of it all was difficult. And so that's why we actually started this program. In North Carolina, the only school so far is NC Central. However, if there's anybody here who's working with other universities, I would love to connect to see how we can expand that program there. Then we have our environmental justice program. So we focus a lot on natural disaster preparedness. We have something called an EJ Escuelita, where we talk about what are the things that are affecting North Carolina's environment to sustainability, and we work on advocacy. And from that was born our EJ Coalition, which is called, actually, I already forgot what it's called. I apologize. But this is a coalition that is not only other nonprofit organizations, but it's also leaders from the community in Eastern North Carolina who want to see these changes happen so that they can better prepare for a natural disaster or better recover from a natural disaster. A lot more money is spent in a natural disaster if you are responding after the fact than preparing. So that's really what this coalition focuses on. There is a lot of administrative advocacy that happens with this coalition because they do meet with emergency management of like Eastern North Carolina counties to talk about ways that they can actually change their rules and their policies to better support the community that doesn't speak English or the community that doesn't receive the news as easily as they think they may provide it. So it's a lot of like cultural approaches with this administrative advocacy. And I'll pass the mic to Sarai to talk about our health program.
Gracias, Anaí. Wow, como ven, nos mantenemos ocupados. Pero bueno, el programa de salud, como les mencionaba, soy gerente de programa de salud. Y para nuestro propósito con el programa de salud es promover el acceso equitativo a servicios de salud, recursos comunitarios. Empoderamos a las personas con información, apoyo confiable, oportunidades educativas más que nada para que puedan fortalecer su bienestar, ¿no? Tenemos varios programas. El número uno es una línea telefónica de salud. Esta línea es una línea bilingüe para todas las personas en el estado que estén en busca de recursos o quieran saber acerca de algún proceso, de algún beneficio para su familia, para sus hijos. Nuevamente ofrecemos educación. El tipo de educación que también ofrecemos en esta línea es sobre la expansión de Medicaid, por ejemplo, mercados de seguros como el Marketplace, y otras opciones de atención médicas, ¿no? Como las clínicas comunitarias o lo que le llaman los FQHCs, Federal Qualified Health Centers. Otros servicios que también ofrecemos son conectarlos con recursos de salud mental. De hecho, tenemos varios partnerships, varias colaboraciones en todo el estado. Uno de nuestros partners es Mentes Fuertes o Strong Minds. También con los FQHCs, las clínicas comunitarias, Tenemos una constante comunicación, colaboración de cómo podemos ayudar, cómo podemos conectar a las personas que nos llaman pidiendo estos servicios. Y también tenemos una colaboración con los navegadores de Carolina del Norte. am, de igual manera, llevamos constante comunicación para ellos saber cómo pueden mejorar sus procesos, las preguntas frecuentes que tienen las personas que nos llaman, ¿no? Recientemente hemos expandido nuestros servicios. Cuando empezó esta línea le llamamos línea de salud, era porque el enfoque iba a ser el Medicaid. Si se acuerdan, en el 2024 hubo la expansión de Medicaid. Entonces, esa iba a ser nuestra misión, ¿no? Ser mensajeros confiables, conectar a las personas con Medicaid, con beneficios. Pero también ahora estamos brindando información y recursos, conectando a la comunidad con servicios de inmigración, con servicios y educación de conocer tus derechos, con abogados. em, Cuando tuvimos a CBP en noviembre, hicimos una respuesta rápida y nos conectamos con varias organizaciones que estaban brindando comida, que estaban llevando la comida, las despensas a las personas. Nos conectamos con algunas clínicas que estaban dando ciertos servicios para personas que quizás no querían, que no podían manejar o no querían manejar. También hicimos toda una página web donde la gente podría entrar y ver recursos de conocer sus derechos, etcétera, ¿no? Am, la línea telefónica ha crecido desde julio del 2024, y eso ha sido gracias a los partners que hemos tenido. Tenemos partners como Latin 19 que nos han ayudado a compartir información, nos han ayudado con el outreach. Tenemos partners en todo el estado, desde el este hasta al oeste en las montañas. Tenemos partners en el Triad también, en Burlington. Y la verdad que esto no puede ser posible sin ellos, ¿no? Gracias a ellos que ayudan a nuevamente compartir esta información y nos ayudan a crear esa confianza en la comunidad. Am, Esta línea de salud y voy a compartir el volante cuando terminemos la presentación. Es completamente gratis. Nuestro personal está entrenado para entender estos servicios, para entender los recursos, para entender la comunidad. Tenemos entrenamientos constantes de todos los cambios que han pasado para que ellos puedan dar esa información confiable, especialmente en estos momentos que está pasando todos estos cambios del HR1 con estampillas, ¿verdad? Las elegibilidades. Entonces, nos tomamos muy en serio todos estos entrenamientos para poder dar esta información correcta, adecuada para las personas que nos llaman. Am, la línea está abierta de lunes a viernes, de 10:30 a 6:30. Nuevamente nuestro staff habla inglés, español, y aunque nuestro enfoque, ¿verdad?, es la comunidad latina, yo siempre digo, es para cualquier persona, ¿no? Nuevamente vamos a compartir ese volante cuando terminemos la presentación. Em, ¿Cuál es otro enfoque de la línea de salud? Tenemos ferias, como ven en el screen. Hacemos, organizamos feria de salud en colaboración con otras organizaciones locales. Muchas de estas organizaciones locales son los partners que ya tenemos que nos están apoyando con la línea de salud. Entonces, lo que hacemos es traemos a organizaciones, a recursos, a otras non-profits que puedan brindar esta información. Proveemos acceso a servicios preventivos, exámenes de salud, información educativa y nuevamente recursos en la comunidad. Y pues creamos un espacio que ellos se sientan a gusto, ¿no? Yo siempre digo, a nosotros nos gusta la fiesta, la pachanga. Entonces, cuando nosotros tenemos estas ferias de salud, llevamos bailes culturales, llevamos música, DJ, hacemos juegos. Entonces, es algo muy bonito donde la comunidad no solamente em, puede tener su cuidado preventivo, pero también es un día de familia. Ves a los niños bailando, brincando con sus padres. Estoy muy orgullosa de nuestros partners. Todas las ferias de salud que hemos tenido, puedo decir que tienen una atendencia de aproximadamente 500 personas o más. Nuestra última feria de salud fue con valores en Día de los Muertos, y tuvimos más de 2,000 personas que atendieron esa feria de salud. Entonces, nuevamente, esto es gracias a su trabajo de ellos y la gran, el buen trabajo y la confianza que tienen en la comunidad, ¿no? ¿Qué más? También tenemos seminarios de salud mental que también, Jania, si me puedes ayudar a compartirlo ahí en el chat. Estos seminarios de salud mental es para ofrecer recursos para reducir el estigma de salud mental. Presentamos información práctica y cultural también. Conectamos a las personas nuevamente con recursos disponibles en la comunidad y es un espacio donde podemos hablar, podemos tener conversación acerca de las dudas. Tenemos uno este jueves, mañana, de hecho, donde vamos a estar. Este seminario va a estar enfocado en las personas que trabajan en la comunidad. Entonces, si tú trabajas en un non-profit, si eres voluntario, si trabajas en la escuela, eres maestro, vamos a estar hablando acerca de ese burden, me disculpan el Spanglish, ese burden que a veces tenemos, el burnout también, y cómo nosotros podemos lidiar con nuestra salud mental para poder mejorar nuestro servicio y nuestro apoyo hacia la comunidad, ¿no? Em, ¿Qué más? Ya casi voy a terminar. Tenemos talleres educativos. Actualmente estamos ofreciendo talleres en el este de Carolina del Norte. Tenemos un grupo de alrededor de 20 personas, 17 a 20 personas, y nos reunimos todos los meses y damos talleres de salud preventiva. Ahorita estamos terminando una sesión de ejercicio y nutrición. En el próximo mes vamos a estar ofreciendo un taller acerca de CPR y les vamos a estar dando un certificado a esas personas que vayan. Y todo gratis. Nos juntamos los sábados. Es un espacio donde ellos pueden llevar a sus niños. No solamente los adultos aprenden, sino también los nenes, ahí luego los ves poniendo atención. Am, y al final de estos talleres, es una sesión, son unos talleres 11 que vamos a tener, les vamos a dar una compensación a esas personas, se van a graduar de de esos, I guess, esa serie de talleres que vamos a tener y también les vamos a estar compensando a las personas que terminen esos 11 talleres, ¿no? Am, y lo último también es que hacemos abogacía. Nosotros colaboramos con organizaciones como NCDHHS, colaboramos con organizaciones como the NC Justice Center y brindamos nuestro feedback, ¿no? De lo que vemos en las health fairs, de los que escuchamos en la línea de salud, de lo que nos dicen nuestros partners cuando nos juntamos mensualmente y hablamos de todo lo que están viendo en la comunidad, ¿no? Entonces, si tienen alguna pregunta, si gustan colaborar, estoy más que dispuesta en tener esas conversaciones. Siempre estamos buscando a más aliados, a programas que podemos agregar a la línea de salud, recursos que podemos brindar a la línea de salud. Entonces, si están aquí el día de hoy y tienen algún servicio que ustedes crean que podamos ofrecer en la línea de salud, o si quieren que los agreguemos a nuestra lista de recursos, definitivamente déjenme saber. Se pueden conectar conmigo o de igual manera Jania puede conectarlos conmigo.
Thank you, Sarai. So this is the last program that we'll talk about today, which is our immigration program. Our immigration program started in 2023, I believe. We've been doing this for a couple of years now, and it's actually a mobile program. So we will travel across North Carolina and do these 2 day clinics. So the first day we will do a 2 hour Know Your Rights training. And these Know Your Rights are focused on what to do if you have encounters, or what you could do if you have encounters with an immigration official or even police officers. And we talk about how you should handle or how you could handle that situation if you're in your car. So, what laws apply when you're in your car versus when you're in your house versus when you're at your job versus when you're at a school or stuff like that. And then the second day, we do an 8 hour clinic where we bring an attorney, we bring notaries, and we do about 15-ish appointments where we will help you apply for citizenship if that's what you need. We also do power of attorney letters. We also do TPS renewals. On occasion, we will do green card renewals, but that's kind of like a case by case type of thing. We've done family petitions, but also a case by case type of situation. The reason why it's like a case by case is because sometimes these types of petitions require more follow up, and because we travel, we only go to one place per. We only go to that one location once a year. We don't like to take cases that would require a lot of follow up because we won't be available to do that. So we do 10 a year. Every month we will go to a different location, and we focus on rural areas where there's not a lot of access to immigration attorneys. Or we will do the city of Charlotte. And the reason why is because that's where we have an office. And rural, it's because there's a lack of access to attorneys who are bilingual and who can support you with your immigration cases. We also have the Citizenship Academy. This is focused on helping people who are applying to citizenship but don't know how to get started. The process it sounds simple, but it requires a lot of paperwork. It requires you to know a lot of information. It requires you to be prepared. And so we talk about how to start that process, how to know if you're prepared. And then, of course, we go over a couple of the questions that they ask you for your naturalization interview. We prepare you so that you know that you are going to have to write, you're going to have to read, you're going to have to be able to answer 12 questions, which is actually new. It used to be 10. So you have to be able to answer those questions and how to study best practices and stuff like that. We cover the most common questions. So easily researchable questions like how to find who your representatives are so that you know who they are and you can answer those questions. and stuff like that. We also do advocacy in our immigration program, and there's two levels to this. The first is located in the city of Charlotte, where we advocate to the school district to provide support for students that have immigrant families or come from immigrant families, or students that are immigrants themselves, so that they can have mental health support, so that they can be protected when they're going to school. And then we also do advocacy at the state level, where we just advocate against any anti-immigrant bills that may come up in the General Assembly. For example, we did some advocacy for SB 318 and SB 153, which we are still following. It hasn't been voted on. I'm so sorry. I'm trying to speak up. Are you able to hear me? Yes? Okay. Um, so I was just mentioning that we do advocacy at the state level as well, where we advocate against any anti-immigrant bill that may come up. So we did some advocacy on the two anti-immigrant bills that came up last year that expanded detention for people. It expanded the list of reasons why they may check your status. So we did some advocacy on that, like spreading the word, calling representatives, making sure that we were heard, going to the General Assembly and stuff like that. And if you are interested in hosting an immigration clinic with us, we would love to work with you. Again, we're focusing on rural areas. We do 10 of these a year. Right now, we are looking to do July through November. We have like up until then, we have it pretty filled up. The organization will receive a $5,000 stipend to provide support to help them if they need to rent out a space, buy the food, stuff like that, and then of course recruit the participants. You can send me a message if you're interested in working together for that. I'll put my email in the chat. But with that, I've talked about all our programs. I know I talked a lot and I know I may have talked fast, so I apologize for that. I'm happy to answer any questions about the organization or, opportunities for collaboration or anything like that.